Well, good morning, everyone. It's great to see people here at early in the morning. So last week, on Friday, we run a Wisdom and Wellbeing series at the University of Virginia. Don't you like the title of that, Wisdom and Wellbeing? And it was a happiness researcher, Dr. Diener. And he started his talk with, grand rounds. You have to have the conflict of interest. And he says, well, I've been married for 44 years, so I'm not going to say I don't have any conflicts, but I don't have any that you all would be interested in. So I think I could say the same thing, even though I'm a dean at a big academic healthcare center. So it's really, really wonderful to be here. I realize that William Shoemaker, this lecture is named for him as well. He's an icon in the Society of Critical Care Medicine, one of the founding fathers, third president. He's sort of like the Thomas Jefferson of the Society of Critical Care Medicine, if I could be so bold and say that. So I'm really thrilled to be here and talk about creating a healthy work environment. And I want to thank the Society, especially Sophia Rogers and Lauren, for inviting me, a nurse, to be here with all of you today. And while this is not a talk on sepsis, I think what you're going to see is these are some hard concepts as well. So here's my outline, what I'm going to talk about. Why is a healthy work environment important to patient care and the care of practitioners, all of us? What is the current state of a healthy work environment in critical care? And I hope that many of you work in some amazing places, but the national scene is that it's a big challenge right now. And finally, what does it mean to create resilient practitioners? And I'm really looking forward to sharing a lot of what we've been doing at the University of Virginia and things that I've cared about for my whole career as a critical care nurse. So I want to thank all my AACN buddies that are here. Many of us, yay AACN, many of us are longtime members of the Society of Critical Care Medicine as well, and we've always applauded the multi-professional society that this is. So AACN about 10 years ago now established the standards for sustaining healthy work environments, a journey to excellence. And boy, is it a journey. It is still a journey. I'm going to share this list here of them. They've stood the test of time. Many other organizations have adopted them as well. And I'm going to just share two of them that I think are key to our work here today. But all of them are pretty amazing. So skilled communication, nurses, and we can fill in respiratory, our PA colleagues, physicians. We have to be as proficient in communication skills as we are in clinical skills. The other one, true collaboration, which means a lot for us here. Nurses have to be relentless, I love that word, relentless, in pursuing and fostering collaboration. And just like your president, your current and past presidents, when you're a president, you get to be invited into some pretty amazing spaces and ICUs all over the country. I got to go to Cleveland Clinic, got to go to Lafayette General in Louisiana, got to go to Mad River Community Hospital in Eureka, California. I don't know how many have been to that hospital. It's like flying into a 7-Eleven going to Eureka, California. But in every one of these environments, every single one, nurses would tell me how fabulous it is. Their coworkers are wonderful. And then I'd be, kind of heading out of the unit with one terrific nurse giving me a tour. And she'd say, well, they're all wonderful here except for this one nursing director, or this one cardiac surgeon, or this one. There was always one bad apple. There's always one bad apple. And it seems to me that brings down the morale, and that creates some really unhealthy and toxic work environments for everyone else there. So I'm going to be talking a little bit more about some of that and what that means. So AACN has done two really landmark studies. The Silence Kills one 10 years ago in 2005, which really showed when people don't speak up, when people don't work on helping that bad apple, either to improve or maybe go somewhere else, patients can actually die when we don't speak up. This study got lots and lots of attention, and it's still right on our website if you want to take a good look at it. A couple of years later, we did another study, Silent Treatment, with the operating room nurses, sometimes a hotbed of disrespect. And we were disappointed to find that indeed disrespect is still rampant. Of course, we did include the OR in that. But in our critical care units, people were sad, still toxic environments. At this point, 20% of nurses felt that they could speak up. In the former study, only 10%. So we're making progress, but gee, is that really enough? And I love this quote, and today we celebrate Martin Luther King's birthday. Some of your children actually don't have to go to school today, is what I would hope. I have no idea where they are, but it is a federal holiday. And this quote is a guiding principle for the way I try to live. Our lives begin to end the day we become silent about things that matter. So what are you all being silent about that we should really find a way to bring up and raise, to make our units and to make our coworkers' lives better? I think this is pretty amazing that Martin Luther King has said this. So healthy work, do we really have healthy work environments? We have incredible shortages where I am on the East Coast. We have moral distress, lateral and vertical violence such as bullying, nurse to nurse, unfortunately, young nurse to old nurse, not always old nurse to young nurse. We certainly have disrespect with physicians and nurses, again, both ways. Nobody has it cornered on that. There's quality and safety issues. We work with many that we would call working wounded and who are burnt out. The issue about being burned out is true of ICU nurses as well as physicians. Post-traumatic stress syndrome is present. Moral distress, where you go home thinking that you really went against your conscience that day, maybe in the care of a patient at end of life, maybe in a dialogue with someone where you really felt pushed to do something you didn't think was the right thing. We have huge issues with moral distress in nursing, and it's more and more recognized in our physician colleagues. So AACN every few years does a study and looks at, okay, in the nation, how healthy is our environment? And this is just one example. Meaningful recognition is another one of my favorite standards. Meaningful recognition is where nurses are valued, are recognized for the work they do, and they recognize each other. This is not a mug on Nurses' Day. This is every single day. My favorite example of meaningful recognition is when a nurse, giving off-shift report, say 7 a.m., that nurse has worked 12 hours. Wouldn't it be great if the day nurse said, I love to follow you. When I follow you, your patients are so well taken care of. That's meaningful recognition. How well do you think that nurse would go home and sleep that night? Maybe not run off the road, for sure. So look at these meaningful recognition scores. Again, 1 to 4, 4 is the highest. You see where we were in 2006. It was about 3,000 members surveyed. Went up a little in 2008, but look at 2013. Now, have our expectations gotten higher? Perhaps. But this is a challenge for us. We would like to see it be going in another direction, for sure. So I point that paper out for you to read, hot off the press this past summer in Critical Care Nurse. Burnout has been defined for a long time. There's a session later this morning at 10 o'clock with all the critical care societies coming together to talk about this issue. So I'm not going to spend a lot more time on it, but here are the key pieces of it. And if this isn't you, you're working with somebody who is feeling this way, feeling inadequate, incompetent, and possibly very inefficient, having an unhappy life. So why do our patients and families care? Well, in this one study, we found that nurses reported high stress levels, and the hospital also had higher infection rates. When we decrease the burnout in nurses, we can have fewer infections and cost savings. So this absolutely has implications for our practice. The cost of bad behavior. Again, I don't want you to think I'm obsessed about this, but again, every unit, every hospital, there are people that are like this lion here. Sometimes it's a little more subtle, but in the United States, it's billions and billions of dollars a year of lost effort, lost efficiency, and people that are sad and unhappy because of something related to work. So who burns out and why? And what about the ones who don't, which gets us into the resiliency part of the talk, you know. We did another study, AACN did, Mueller, not AACN, it was an AACN, members were surveyed here. 80% experienced burnout, 22% were highly resilient in this paper by Mueller. The resilient nurses tended to look at spirituality, they tended to be optimistic, they had a strong social network. So there's things that we can learn from those who are resilient, and is why I've committed my life as a dean to creating resilient healthcare practitioners for the future. This is a Medscape slide about the wishes, the top wishes that nurses have. You can see more compassion is in there, reduced patient load, better benefits, etc. We have a lot of wishes. We have a lot of wishes. This was one of my favorite medical students who graduated last year from the University of Virginia and is now at Yale. He wrote an op-ed piece in the New York Times called "Why Do Doctors Commit Suicide?" after 2 residents who had graduated in May in 2014 committed suicide in New York City last year. Doctors, 400 physicians commit suicide every year. And they have resilient strategies too. This is a German paper that came out which looked at 200 physicians and was published in Academic Medicine 2 years ago. So if every 5th physician is affected by burnout, what about the other 4? What can we learn? Well, they have practices such as family and friends, mindfulness, and hold that thought because I want to talk about mindfulness, personal reflection, and useful attitudes, appreciation. When I talk about solutions, I'm going to be talking more about that as well. And it's time to talk about solutions because really, it's time to talk about solutions and a call to action. So I'm going to start here with this. And it's from a paper powered by FAAN. It's actually a book by Jim Clausen, who's a professor in our business school at the University of Virginia. And look at this. The surgeon had 2 routes to the operating room. One took him through a dark hallway filled with empty boxes. The other, more time-consuming, key point, route took him through the main hospital where he passed windows, plants, and co-workers. The latter gave him energy, but the former did not. So if he were your heart surgeon, Jim says, ask yourself, what route would you want him to take before he operated on you? Fast and discouraging, or slow and uplifting? Now, time is an incredible commodity. Krista Tippett, a wonderful woman who has a show on NPR, has said that time is too often a bully. I think a lot of you would agree with that. Time can be a bully. So I'm going to shift gears here now and talk about time. There's another paper that just came out, The Half Wall. I like this because it was about nurses and physicians. Dr. Rafelson, I think he's from Brown, and Teresa Brown, who's an English PhD and then turned around and became a nurse. And now she writes about our specialty. Oh, my. And she's a great writer. This paper said, the physician speaking, the nurse can be our greatest ally, but we must learn his or her name first. And in the act of rounding together, something unexpected may happen. Nurses and physicians may even become friends. This is another wonderful, wonderful paper. John Dent, who's a cardiologist at the University of Virginia, went to a special program. I'm not sure if it was at Harvard or Wharton or somewhere, and learned about a pretty incredible way to have a rounding in a med-surg. This is a cardiac. This is an ICU. And look at what he did with patient satisfaction in the blue. It's almost up to 90 when the rest of the hospital is not where it should be. And he did this in a dedicated way, saying nurses will be involved. The patient and family, if possible, will be involved. And we will wait till the nurse gets there. We will wait. This is called respect with a capital R. He had a lot of issues getting this through, and he told me I could show this slide, so I hope... I just would like to congratulate him on this work. The rest of us have more to do. The triple to quadruple aim, this is another paper that suggests, okay, these aims about population health, looking at efficiencies, these are great aims, but what about care of the provider? It's time to talk about care of the care of the provider. So at the UVA School of Nursing, I've been there for about 7 years now. I've decided, and people are coming to the forefront with me, to create compassionate nurses and leaders for the 21st century and to just call it out. I love the way Phil Dellinger, in his great top 10 list yesterday, number one, what was number one? It was compassion. It was like he was teeing it up. He was teeing it up for today. So, now this is bizarre. I don't think we need to all jump into yoga right now, but those of you that do yoga, you know what one that is, right? Triangle. So, this is a scene from my front door. I get to live on the lawn that Thomas Jefferson designed at the University of Virginia. Deans and vice presidents, there's 10 houses. We live with 50 students that are very active, I might say, especially at 2 and 3 in the morning. So it's great to live there, but you get what you get. So we have reunion weekends every June. And 2 years ago, they decided to start having yoga as part of it. And there were 2 little people out there doing downward dog in front of my house. And look what happened last year. Look what happened last year. So some of these practices I'm going to mention are actually moving out of kind of woo-woo into very, very mainstream. So what is compassionate care? Why is it needed today? I think you'll agree with me that we have many people in our field who have a broken heart. They came into healthcare thinking they would be able to do one thing, and it's gotten really, really tough. So this is my no rushing slide. First of all, there's a lot of reasons that we need to rush, and I don't want to take that away, all right? Sepsis, people need pain medicine. Yes, rush for that. But if we live our life rushing all the time, we're missing a lot. I sat next to the chief executive officer of Jacoby Medical Center in the Bronx last May. I was giving a talk on trauma nursing up there. And we were chatting, and he told me of a scary experience he had in one of their sister hospitals in the Bronx, where he was having an outpatient procedure, and they were all in the waiting room. And it was early in the morning, but everybody was rushing around, and people were kind of speaking sharply to each other. And, the people in the waiting room were getting a little anxious. And finally, a nurse came in and just said very loudly, "All right, we're going to slow it down here. Everybody's going to get taken care of, but we don't want to make a mistake." And he said every patient in that room just kind of said, okay, okay. So sometimes rushing around, we ask people how they are, and what do they say? I'm so busy, instead of saying, I'm chronically well, thank you, which is what a good colleague at Georgetown used to say. So our Compassionate Care Initiative is to reduce human suffering by cultivating compassionate people and systems, and again, calling it out. Compassion, this Sharon Salzberg, who's a wonderful meditation guru, says it's experiencing a trembling or quivering of the heart in response to another's pain. And do you remember what Dr. Dellinger said yesterday? His last words were, I'm holding hands more now at this point in my career. So what if we could teach 25-year-olds to hold hands more? What might our patient satisfaction look like? Empathy, putting yourself in the shoes of another, is a precondition for this. Interesting studies of medical students. Guess what they show about empathy over the course of 4 years of medical school? Guess what happens to empathy? Decrease. They end up with less empathy in the 4th year than they had when they came into medical school. We wrote a paper, actually it was an editorial. I found in Charlottesville it's actually not that hard to get in the newspaper or on TV. But once you've got an editorial out there, people pick it up. This one kind of went crazy too. Can empathy and compassion be learned? Absolutely. But they won't be learned if we don't talk about it, if we don't encourage it, and if our students and trainees don't see role models for empathy or don't feel like they're treated with empathy. So, we are teaching people how to be present, be fully present in the moment. This is going to get us into mindfulness. When I first got to UVA, I was a new dean, and my other deans were all sitting there. There's 11 of us, and the president was talking to us in a conference room, and every single one was like staring at their crotch. They were all using their what? Looking at their iPhones. They'd all heard what the president had said before, so it was like we had a one-on-one. But you know, multitasking is really overrated. There's been studies, University of Michigan, that shows it fatigues the brain. You think you're getting a lot done, but you're actually missing things. And being present, being fully present, is what it's all about. So what do people see when they see you? This is what I challenge a lot of my nursing colleagues. Do they see somebody rushing around, going from meeting to meeting, kind of mindless? I had a good friend who was a patient care representative at Georgetown, and she said to me, Dorrie, I go to a meeting, and if they don't use the word patient in the first 3 seconds, I leave. Clearly, this meeting is not something I need to be at. Compassion is a rigorous dance. Roshi Joan Halifax, who runs a monastery in Upaya, Santa Fe, where we have now sent 70 University of Virginia nurses, physicians, social workers, and chaplains to learn an 8-day program on being with dying. People come back very different. I know it doesn't sound too exciting, but we had Jane Fonda's chef, even though it was vegetarian. It was great. Everybody gained weight. It was silent. We ate. So compassion is a rigorous stance. She taught us that having a strong back to do the tough work we do, but having a soft front to be open and caring is what it's all about. And as you see here, she talks about science. We live in a time when science is validating this. So I was privileged to be on a panel with the Dalai Lama, if you can believe it. He came to Charlottesville. His translator had been a University of Virginia professor for many years. And so I was on a panel called Compassion as a Global Remedy. 3 physicians. I'm sitting next to the head of pediatrics here, and me. It was pretty amazing. And I got to talk about the pause and what we're doing at the University of Virginia. And he's, doing something with me there with the hands. But his eyes are absolutely incredible. Talk about somebody who is happy, in the moment, fully present. It was pretty awesome. I've also hired people to help me with this work. I've been doing this work since 2009. To be honest with you, I've had some pushback. Some of my faculty originally thought I was pushing religion. It's like, no, meditation, mindfulness are actually a part of the world's religions, And it's really how to be. It's not about pushing something. So I hired Susan Barrow-Wu. She has over $6 million of NIH funding looking at patients undergoing bone marrow transplant and using meditation and mindfulness. They might not live longer, but guess what? Their quality of life is extraordinary. And their family members, the quality of life of their family members. So she has written a book for the general public called Leaves Falling Gently. I really recommend it to you. So she and I now are doing this work together. Time Magazine talked about this a couple of months ago now, the mindful revolution, really about finding focus. So we have this resiliency initiative. I want a signature of our School of Nursing to be that every single nurse leaves ready to join the workforce, have the skills to not be brokenhearted, to withstand the pressures, to not get downtrodden if they end up in an unhealthy work environment, but actually to learn how to create a healthy work environment. And so we're spending a lot of time on that, and I want to tell you a little bit about it. We also wrote a paper for the Huffington Post called The Architecture of Resilience. What is this all about? Resilient practices, as you see here, things like meditation, yoga, reflective writing, deep breathing, even physical exercise make for happier, stronger, more centered clinicians. So I want to tell you a story. This is Jonathan Bartels. He's from Buffalo. He's an ER nurse, and now he's moved into palliative care. It's amazing how many seasoned clinicians tend to drift towards palliative care, taking care of people at the end of life these days with their wisdom. So he's part of the Compassionate Care Initiative. We went to Upaya together in 2009. I always thought he was a little rough around the edges. You know, look at those tattoos. But patients and families love him, right? Patients and families love him. So he was very struck by the fact that in our busy ED, where, you know, there's people in the hall, when a code would come in, maybe it was a 7-year-old, maybe it was a 80-year-old, and things didn't go well and the patient died, the team would just discouragingly, you know, pull their gloves off and leave and go out the door and get what's out the door? The next patient, right? So he decided to institute a 45-second pause. And all it is people stop just for 45 seconds and in their own way honor that patient who nobody knew and honor the good work that the team had done. This is a picture of it, simulation. And I knew it was catching on when there was a tough code a few months later, and an anesthesiologist up on our 5th floor said to all the people in the room that day, "Can we all stop and do the pause like we do in the ER?" So when an anesthesiologist is carrying a message about something good that nurses started, you know we've hit a nerve, right? This is what people want. They want to be recognized. They want to be thanked. We even have patients and we even have the family members now being part of it. And guess how supported they feel in our ER at UVA. So it started by nurses. So compassion is also bringing up the need for kindness. And I wanted to tell you a story again about a wonderful African-American, Colin Powell. It's in his book. He was Secretary of State, and one day he just got a little restless, so I guess he ditched the security people, and he walked down to the parking garage, as the story goes. And he was wandering around and then, you know, stretching his legs, and he went up to the front, to the gate where the people work. You know, they're immigrants in D.C., making minimum wage. And he talked to them and said, you know, I've always wondered, you know, there's not enough places to park. Cars are everywhere. He goes, how do you all decide who gets to go out first? And they looked at him and said, well, Mr. Secretary, when you come in the morning, if you know our name and you say hello and good morning and how are we, you're going to be getting out first. And if you come in and if you drive through that gate and don't look us in the eye, you're going to be waiting a long time for your car. So just so you know, that's how it works. You're not surprised, right? Do you all know the names of everybody you work with? Do you say hello every morning? This is what makes a healthy work environment. This is what makes a healthy work environment. It's a great book. It's called It Worked for Me, Colin Powell. So our Compassionate Care Initiative begins with contemplative practices that are now across our whole school, and we've brought all our medical school colleagues in as well. It begins with awareness, presence, and this whole concept of resilience. As Susan has defined, mindfulness is a way of being and relating to ourselves, our circumstances, each other, and the world around us. It's an attitude of openness and curiosity, which you cannot have if your eyes and nose are where? In your iPhone. You should see, I'm almost running over our students at the University of Virginia because they not only have earphones in, but they're using their iPhone and they're crossing the street. You know, it's kind of lethal. So what are you willing to notice in your world? That's what we ask our students and our trainees. What are you willing to notice? Mindful or mindful? Look at the dog here. Do you know? Focus, right? What are you willing to notice? I love this picture. It's a lot like the picture I showed you of the 100-year-old woman and the nurse. You know, this is being fully present, right? Unconditional love, fully present. So I want to use this analogy. I'm a sailor. My buddy here, Connie Barden, is too. We have our sailboat in Annapolis. I'm a fair weather sailor. I open the champagne and make the turkey sandwiches. But I wanted to use an analogy here of how mindfulness, and taking a deep breath can really help us. A deep breath, and we tell our patients to do this, but when do we do this? A deep breath is like an anchor. When you take a deep breath, you anchor yourself through the floor, through your feet, and then you look up, even if it's rough seas, right? Things seem more calm. And people look to you as the critical care leaders. People look to you and me and all of us to do what? To be this calm presence. Mindful clinicians are associated with better patient care. This is just one study from a year or two ago. Patient ratings of quality care, clinician encounters, and high mindful clinicians were associated with more positive emotional tone. This will increase patient satisfaction, clearly. Plus, it's the right thing to do. And you feel better when you're doing it. It's almost selfish in a way. So our compassionate care vision at University of Virginia is to have safe and high-functioning healthcare environments with healthy and happy nurses, happy physicians. What if people came to work happy? That could be a stretch based on their getting the kids up, etc. But what if they left work happier than they got there? Stretch goal? Anybody? People leave work happier than they came? And where heart and humanness are valued and embodied. This is one of my third-year students. She just applied and won a grant with a fourth-year medical student to look at how, from the Lown Institute, which is really worried about financing healthcare and overuse, overdiagnosis. And she and this medical student have a project with Susan Barwu to look at how paying attention, being mindful, resilient strategies can help us make better healthcare decisions. Be wise practitioners. Use wisdom. So what else are we doing? We're integrating into the schools of nursing and medicine, the whole hospital. We've built a resilience classroom where we do mindfulness, we do meditation there. 6 a.m., we're up to 5.5 years, docs, nurses. I'm there every Wednesday at 6 a.m. doing meditation with some of our healthcare folks. I say to my faculty, well, if you need to ask me something tough, 7 a.m. is probably a good time on Wednesday when we're all there together. I've also built a contemplative classroom. It has 40 yoga mats. It has cushions. It's got nice lighting. These rooms are completely full. We offer free yoga and meditation 5 times a week. We're right across from the hospital, right next to the medical school, so it makes it easy for us to come together. I say it's free, I'm paying for it, but it's free because I raise the money and that's the right thing to do. And talk about building collaborations. When you pay for something and then invite your multidisciplinary colleagues in, it gets noticed. We're also doing formal courses, mindfulness courses, meditation courses. They're always packed with a huge waiting list from the entire university. I just started a course last week called Medical Yoga for health professionals. And a resident called me and said she couldn't get the tuition discount, whatever, to take the course, whatever. So I gave her a scholarship. I thought, boy, I hope you stick around for a while. But that's the right thing to do. That's the right thing to do. We have resiliency retreats for every nursing student. We have physicians join us. We have, dental techs. And we have something called Compassionate Care Ambassadors in 26 units. People have a project. Again, I've sent 70 people to Upaya. When they come back, they are all part of our initiative, and they're ambassadors. This is a paper I wrote, a chapter in a book with Cinda Rushton, who's a longtime SCCM, ACCN clinician. And we just posed this. If we truly practiced with compassion and empathy, what would our healthcare system look like? More importantly, how would we be transformed? And how might this really change outcomes for patients and families? This is a book from some of my colleagues, Wisdom Leadership. I love the original title was supposed to be Leading Change and Changing the Way We Lead. It's that changing the way we lead that's really the key. So I'm going to invite you to consider how you can have your day, practice, invite stillness and inquiry. How many of you have stood like that in a patient's room with all those drips? Right? Take a breath, focus. What's the most important thing? How to take care of each other. So our focus includes interprofessional education. We have found that the best way to help people understand the tough environment out there is to let nursing and physician students understand each other's roles. This goes for nurse practitioners, PAs, residents. So we're doing a lot of training. We have some grants to do this work. We train every third-year nursing and medical students in a course called Difficult Conversations, How to Give Patients and Families Bad News. They role model with standardized patients, how to tell somebody you made a mistake. Did any of us have that in school? I don't think so, but that's what we're doing. We have a wonderful colleague, Julie Hayslip. She's a pediatric intensivist, and she developed this room of errors. This is the adult version of it, but in the pediatric one, there's a simulated patient room in the PICU with 30 errors. And she's doing studies with nurses, physicians, pharmacy, social work, OT, PT, where each discipline goes in alone and writes down the errors that they see separately. And then they all go in together in another sim. They all go in together. And guess what happens with things that people notice? It's pretty incredible. She is now working for me. She actually applied to be on my faculty in the School of Nursing, and she has big grants to do interprofessional work. We just got a HRSA grant to look at safety and quality, training acute care MPs and medical residents together. And she's doing this work. And finally, this is Pranay over here on the right. Like I said, my favorite medical student, who's now up at Yale, with Susan Murphy and Andy, another one. The students came to us a year ago and said they wanted more content on dying patients and end of life, so they created a course. And they invited the faculty to come in and teach it. It was pretty special. And then we raised money for a big dinner where we got together because it's, over 300 students, and we had to have many, many facilitators. So we found people that wanted to fund this work. So I'm going to end, just about time, I'm going to end with the 3 C's. Now, the 3 C's came out of my son's experience. When I was at UCSF, he was in high school. He went to St. Ignatius right on the ocean. It was really a beautiful, beautiful place. And he had a favorite English teacher, his 4th, senior year, right in the springtime, say March or April. And this teacher, Mr. Castro, told them, all right, here are the 3 C's for going to college. And the 3 C's were, you got to go to class, you got to not use cocaine, and you got to use a condom. Well, this is a Catholic school, so when the kids got home saying this, hey, Mr. Castro said, some of those little parents were a little kind of wigged out. But then we realized, it's actually pretty good advice. So in relation to Mr. Castro, I'm going to do the 3 C's for cultivating a pause in your life and resiliency, which will lead to a healthy work environment. The first one is consider a contemplative practice. Now, you don't all have to be getting up doing downward dogs or whatever, but you need to be doing something. Think about doing something. And it could even be taking a deep breath before going in a patient's room. Somebody told me when they gel their hands, that's when they do it, and we're all doing that, right? Try to integrate it, not make it separate. So consider a contemplative practice, some of the ones that I've mentioned today. Next, carve out time for gratitude. This idea is out there by many people. Write down 3 things every day or every night, and then it becomes a habit. And you can even do it kind of mentally before you go to bed. I have a book now, and I look back and I go, wow, yeah, remember that. Whenever you're down, you can pick it out. It really doesn't take a lot of time. No matter what kind of a lousy day you've had, 3 good things happened. 3 good things probably happened. And the last one, and I'm quoting our very own, Dr. Farmer here. This was in his Connections last month, December, January. Cultivate a practice of kindness towards yourself and others. A gentleman named George Saunders at Syracuse, professor of English at Syracuse, gave their graduation address 2 years ago. And he spoke about things that he was saddest about, things he regretted the most, and it was acts of unkindness. And he talked about, kind of bullying a little girl in the 3rd grade. Isn't it amazing? He's probably 60, going back to things that were just unkind. So, cultivate a practice of kindness to yourself and others. I'm convinced that if we think about doing some of these things, which I'm trying to do at the University of Virginia with my medicine colleagues, my nursing students, we're going to be putting out a different generation of healthcare providers, ones that will take care of all of us and hopefully in some really amazing ways. This will help us to create the healthy work environment for the future that we're all yearning for. So I thank you. I thank you so much for listening to me today. Have a great rest of the conference.